Hello, my
Hi.
name's Lauren. I'm the student nurse that's going to be doing your head-to-toe assessment today. Can you please state your name and date of birth for me?
Julia, January 24th, 1999.
It's nice to meet you, Julia.
Nice to meet you too.
So, what brings you in today?
I'm just here for a checkup.
Okay, sounds good. So, how old are you?
19.
Okay, are you at school?
I am.
What are you studying?
Business and sustainability.
Oh, very good, very good. Do you live on campus?
I do.
That's awesome. How's the food?
It's been better.
It's college food.
Yes.
Yeah.
That's the best way to say it.
So what we're going to be doing today is I'm going to be doing a full head-to-toe assessment. I'm going to be doing some inspection, some palpation, a little bit of coordination and sensation movements. So if you have any questions or concerns, feel free to ask them.
Okay.
And if you would like anything else to share, feel free to do so, okay?
Thank you.
All right, so I'm going to start with your head. I'm just going to take a quick look. Do you have any headaches or dizziness?
No.
Okay, I'm just going to palpate a little bit. Any bumps or lumps you've noticed?
No.
Okay. Do you wear glasses or contacts?
I do.
Okay. Do you see the eye doctor fairly regularly?
Yes.
Yeah, for the most part?
Mhm.
Okay, so the first thing I'm going to do is I'm going to look into your pupils.
Okay.
So I'm going to shine my nice light right into your pupils twice.
Okay.
Looking at one side, then the other side, okay?
Okay.
All right, so go ahead and stare right off into the distance for me. Here we go. Good. One more. Good. Take a couple blinks for me. Good. Awesome. Okay. So no dizziness,
Nope.
no blurred vision at all.
Mhm.
Great. Okay. So now I'm going to do a couple more eye exams. So what I'm going to have you do is follow my finger with your eye as I move it in different spots, okay? Perfect. Great. Thank you. So now I'm going to do a little peripheral vision check. So go ahead and place your hand over your right eye for me. Good. And I'm going to do the same. And so I'm first going to start on this side. Can you see my finger?
Mhm.
Okay, now I'm going to come from this side. Let me know when you can see it.
Right there.
Perfect. All right, let's switch eyes. You see my finger? Okay, let's go this way.
Right there.
Perfect. Okay. So you see the eye doctor regularly. That's
Mhm.
great. So now what I'm going to have you do is close your eyes nice and tight for me, and I'm going to try and open up your eyelids, okay? Great. All right. Can you give me a shrug with your eyebrows? Can you raise them up for me? Give me a nice big smile, a frown. Can you puff up your cheeks for me? And I'm going to blow the air out. Great job. All right, so now I'm going to take a look at your mouth real quick. So let me get some gloves on here. Do you see the dentist fairly regularly?
Mhm.
Yeah. About every 6 months?
Yep.
Good. Okay. Any lesions or sores that I should know about?
Nope.
Okay. Alrighty. Let me grab my light here. Go ahead and open up your mouth for me. Can you give me a big ah? Ah. Okay. Let's lift up your tongue. Good. Can you bring it to the side? Good. The other side. Can you stick it out nice and straight for me? Okay. Let me just go ahead and stick it back in. I'm going to look around here. Okay, everything looks good. Can you say light, tight dynamite for me?
Light, tight dynamite.
Great. So school's been good for you?
Mhm.
That's awesome. That's awesome. All right, so now I'm going to sort of move down. I'm going to look at your jaw next. Do you have any problems chewing or swallowing at
Nope.
all? Any pain in your jaw?
No.
Okay. So let me just palpate it real quick here. Good. You clench your jaw for me. Don't let me open up. Good. All right. So now I'm going to move my hand right here, and I'm going to have some resistance. Try not to let me turn you. Good. The other side. Great. Okay. Have you had any problems with your hearing at all?
No.
Can you hear this?
Mhm.
How about this?
Mhm.
Great. Okay. So now I'm going to move down to your neck a little bit. The first thing I'm going to do is some range of motion.
Mhm.
So can you look down for me? How about up? To your right? To your left? Can you put your ear to your shoulder? How about the other side? Good. Any pain or stiffness in your neck at all?
Nope.
All right. Let me just palpate it a little bit here. Great. Okay. Let me find your carotid. Relax. Good. Nice and strong. Let me check this side. Wonderful. Okay. I'm actually going to take a listen real quick before we move on to some other areas. Do you play any sports?
Field hockey.
You do, so you're active?
Mm-hmm.
That's awesome. That's great. Alrighty. Take a quick listen to your neck here. Oh, let me take a look at your... Good. So no swallowing problems?
Nope.
Alright. Let's take a listen. Very good. Okay. So before I move on, I'm just going to take a quick look at your hands really quickly. Any tingling or numbness at all?
No.
No? Okay, let me check your capillary refill. Perfect. Okay. All right, so what I'm going to have you do now is I'm going to have you turn towards me so your back is facing me. Perfect. Let me move this out of our way. So now what I'm going to do is take a look at your lungs in the back. So what I'm going to start with is just inspecting. Any back pain at all?
Nope.
How about any cough?
Nope.
Or a sore throat?
Nothing.
Okay. How about chest pain?
Nope.
You notice any lumps, bumps, or anything like that?
Nope.
Just giving you a quick palpate. I'm going to place my hands here. Can you give resistance when I push down? Good. Okay. All right. So now I'm going to place my hands on your back right here, and I'm going to ask you to take a big deep breath for me. Great. Okay. So the next thing I'm going to have you do is I'm going to place my hand on your back.
Mm-hmm.
When I do that, can you say the words 99 for me?
Mm-hmm.
Okay, go ahead.
99. 99. 99. 99. 99. 99. 99.
Perfect. Thank you. So the next thing I'm going to do is a little bit of percussion. So I'm going to take my finger and I'm going to find a spot and I'm just going to give you a quick tap, okay?
Okay.
On this side. Thank you. Put down your back. This side. I'm just going to lift up your shirt a little bit here.
Okay.
Good, and then go on this side. Good, okay. So the next thing I'm going to have you do is I'm going to place my stethoscope on your back, and each time I do that, can you take a big deep breath in and out of your mouth for me? So if you feel any dizziness, wave your hand, yell my name, let me know, okay?
Okay.
All right, here we go. How you doing?
Good.
Okay, couple more. One more on this side. Good. Are you feeling okay?
Yep.
All right. So I'm going to have you turn back around and face me. We're going to do sort of the same exact thing on the front now, okay? So if you notice any pain at all in your chest?
No.
Okay. Any lumps, bumps, or anything like that?
No.
Do you do regular self breast exams?
Mm-hmm.
Perfect. Those are very important. Okay. All right, so I'm going to place my hands on the front, and you take another big deep breath for me. Awesome. Okay. All right, so I'm going to do the same thing. I'm going to place my hand, and you say 99 for me.
Okay. 99. 99. 99. 99,
Good. I'm going to come on the side here a little bit.
99, 99.
Great. Okay. All right. So now I'm going to do some more percussion.
Okay.
So I'm going to place my finger here. And come on below here. I'm just going to lift this up a little bit. This side. Oops. Good. Okay. All righty. So now I'm going to auscultate, okay?
Good.
Again, take a big deep breath in and out of your mouth. If you feel dizzy, give me a shout, okay?
Yep.
All right. Going down here. One more. Perfect. Okay. So now I'm going to have you go ahead and lay down for me. I'm going to pull this out for your legs here. Is there any chest pain now that you're in this position at all?
No.
Okay, I'm just going to palpate again to feel any vibrations. Sometimes that can happen when you lay down, but you're fairly healthy. Okay, so I'm going to have you look that way for me. I'm going to look at your veins again. Good. Okay, now turn towards me. Perfect. All right, now I'm going to take a look at your abdominal aorta here. Awesome. I can see it. All right, so what I'm going to do is I'm going to listen to your heart in a couple different places. This may take me a little while, but there's nothing to be concerned about. I'm just taking a listen, okay?
Okay.
All right, just stay nice and relaxed for me. Oh, before that, I'm going to actually find your apical pulse first, okay? Just palpate it here. Good, nice and strong. Okay, now we're going to take a listen, all right?
Mm-hmm.
I'm going to come up from down here, okay?
Mm-hmm.
Find that apical pulse again. Now I'm going to pause here and take it for a full minute, okay?
Okay.
All right. Awesome. Sounds great. Okay. So now what I'm going to do is sort of move my way down. First, I'm going to listen to some bowel sounds so I don't disrupt anything before I palpate, okay? So the food is good at Colby Sawyer? Yeah?
For college,
For
yeah.
college? Okay. Do you have regular bowel movements?
Mm-hmm.
Do you have any trouble having bowel movements?
No.
Okay, perfect. All right, I'm just going to take a quick listen, okay?
Mm-hmm.
Start down here, okay? Good, okay. So now I'm going to do a little bit of tapping like I did on your chest just to listen for some sounds, okay?
Mm-hmm.
Let me know if you have any pain at all. Good, okay. So now what I'm going to do is some light palpation, okay? Let me know if you have any pain, okay?
Okay.
Good, how was that? Fine, good? Okay. I'm going to go through one more time, but I'm going to go a little bit deeper, okay? Try and relax. Think of something else, okay? Good. Any pain with that?
No.
Okay. Alrighty. So now I'm going to move down to your legs, okay?
Mm-hmm.
So first, here, let me extend this a little bit more for you. First, I'm going to find your popliteal pulse, okay? So go ahead and give me a quick knee bend here. Alright, so I was having a little trouble finding them, but that's completely normal. Usually that one's a tough one to find, so I would go and get the Doppler, and then I would check those for you, okay? Alright. Any numbness or tingling in your legs at all?
No.
Okay. Let me just take a couple pulses here. Good. Alright, I'm going to slip off your socks just a little bit from your heels. Okay. Socks back on. Alright, so I'm going to apply some resistance to your feet now, okay? Can you bring your feet up? Good. Can you push them down? Good. Okay. So I'm going to go ahead and have you lift one of these legs. Go ahead and lift this one straight up for me. Good. Now the other one. Perfect. Now I'm going to apply some resistance, okay?
Okay.
Go ahead and lift up. Good. Now this one. Good. Can you bring your knee to your chest for me? Perfect. You do this one as well. Good. Alrighty. So I'm going to go ahead and have you sit up now. So now we're going to sort of move on to some more sensory sort of activities, okay? So first what I'm going to have you do is place your index finger on your nose.
Sorry.
It's okay. Place your index finger on your nose, and you're going to touch my finger, and then I'm going to move my finger around, okay?
Mm-hmm.
All right. As fast as you can. Good, okay. So now what I'm going to have you do is take one of your hands, or both of them. We're going to do it with both of them. And I'm going to have you put your thumb to each of your fingers and then go on back.
Do you want me to do that at the same
Yeah,
time?
you can do it at the same time if you'd like. Good. Perfect. Next thing I'm going to have you do is place your hands on your legs or knees. I'm going to have you flip them over and flip them back, and then do that as fast as you can for me. A couple more times. There you go. Perfect. Okay, so a little range of motion with your shoulders. Can you lift your hands up above your head? You bring them down. Can you bring them forward and down? You bring them forward again. I'm going to apply some resistance. Good. Good. Can you reach your hands behind? Good. Any pain with that?
No.
Okay. Can you do some arm circles for me? Perfect. Awesome. So one more thing. I'm going to have you put your arms out to your sides. I'm going to have you touch your nose with both hands. Perfect. Okay. So now we're going to do a little bit of sensory and sensation. Okay now? So what I'm going to do is I have a tongue depressor here.
Mm-hmm.
And so if you want to just place your hands right here for me. So this is sharp and this is do, okay?
Okay.
So I'm going to have you close your eyes, and I'm going to do it in different areas. I won't do your face, but I'll do it in different areas, okay? So go ahead and close your eyes, and tell me if it's sharp or dull.
Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp.
Yeah. Then come down here.
Sharp.
Good.
Sharp.
Perfect. Okay. So the next one I'm going to have you do is the same sort of thing, but I'm going to use this soft cotton, and you're going to tell me when you can feel it, okay? I'm going to start
Okay.
with your face and move down, okay? So go
Alright.
ahead and close your eyes for me.
Yep. 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 Mhm. 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 Yep. Yep.
Okay, wonderful. So one more thing before I have you stand up. Can you take the heel of your foot and drag it down your shin for me? You can do it on the other leg as well. Perfect. Okay, so now I'm going to have you stand on up. Come on this side, yeah? Can you go ahead and walk in a straight line down there for me? Perfect. And come on back and do heel to toe. Awesome. Go ahead and turn back around. I'm going to have you walk on your heels. Now on your toes for me. Perfect. Come on back. So what I'm going to have you do is stand here for me. I'm going to have you close your eyes and then just stand as straight as you can. Bring your feet together. Perfect. And just close your eyes for a couple seconds. Good. Okay, you can open now. So a couple more things. I'm going to have you stand on one leg. Give me a little squat. Good. It happens to both of us. Now do the other leg. Perfect. Any pain or discomfort with that? Okay, why don't you go ahead and have a seat again for me? All right. Do you have any questions or concerns about anything that we did today?
Nope.
No? All right. Well, it was a pleasure to meet you, Julia.
It's a pleasure to meet you too.
Thank you.